Welcome to Mohawk Valley Health System's Safety Patient Resident Handling video. As a caregiver, how much weight do you think you lift in a day? The average caregiver lifts close to 1.8 tons per shift. Injuries and musculoskeletal disorders are common in direct patient caregivers and are often caused by manually lifting and moving patients. This is more than just an inconvenience. These injuries are often life-altering and career-ending. The Mohawk Valley Health System has partnered with Diligent Guaranteed Solutions to begin a journey. Through this partnership, we will fully implement our Safe Patient Resident Handling program. Its name says it all: handle with care. In becoming a minimal lift health system, we will look at three key components. The first is the way we, the caregivers, think about the patient-resident handling tasks. For example, we think 100 pounds is lightweight. This thought is false. We also may feel an extra step means extra time. However, we must have patience for patients. The second is how we assist patients and residents relative to their mobility. This is integrated into our electronic medical records and has current documentation to guide us. And the third is how we perform patient and resident mobility and transferring tasks. According to our Handle with Care policy, we will not perform manual handling tasks. We will use the equipment and knowledge that has been provided to us. We care deeply about our staff and are firmly committed to working with you towards the protection of yourself, your coworkers, and patients alike, while improving the quality of care outcomes at our organization. We truly are embarking on a journey, and we want to thank you for your commitment and dedication to be sure that we all handle with care. Kathy is a nurse, and like many of us in the morning, she is rushing out of the house to get her kids to school and herself to work on time. Kathy arrives at the hospital to start her shift. She loves her job and takes pride in the excellent care and compassion that she gives her patients each and every day. While Kathy is working on EMR documentation, her coworker Chris asks her to help him move Mr. Smith onto a stretcher. Mr. Smith is elderly and quite weak, so he will not be any assistance to Kathy and Chris while being moved. Kathy grabs a set of maxi slide sheets to assist them in the move. Chris takes the sheets and says, "We don't need these. Mr. Smith can't weigh more than 90 pounds soaking wet." Kathy is about to agree with Chris and move Mr. Smith without the assistance of the sheets when she thinks about what that could mean for her daily life. Kathy and Chris let Mr. Smith know that they are going to move him to the stretcher. As Kathy pulls on the draw sheet to transfer Mr. Smith, he yells out in pain. Kathy gives the draw sheet a quick tug to hurry the process. Suddenly, she winces in pain and grabs her back. Kathy and Chris ask Mr. Smith if he's okay, and he shows them a new skin tear on his elbow. Chris asks Kathy if her back is okay, and she says that she thinks she just pulled something, but will be alright. Kathy arrives home after her shift. Her children greet her, and as she leans down to give her son a hug, she falls to the ground in intense pain. Her back hurts so bad that she cannot get up, so her kids run inside to get their father, who calls 911. Kathy is rushed to the emergency department. While she is waiting for the doctor, her mind rushes with everything that's happened over the last day. She starts to wonder if all of this could have been prevented. The doctor determines that they need an MRI of Kathy's back to know exactly what is wrong and to decide on the correct method of treatment. Kathy is brought into the MRI room and placed on the table. The staff takes the images necessary for the doctor to determine the damage that was done to Kathy's back. Kathy is brought back into the room and the doctor comes in to tell her the results of the MRI. He says that the damage is significant and she will need to have surgery and wear back and neck braces. Kathy is extremely upset at the prospect of surgery and the effect it will have on her life. Now out of the hospital, Kathy sits and watches her children play. She remembers the time when she was able to join them, but now all she can do is watch. It is very upsetting to her as she was a very hands-on mother before the accident. As she watches her children play, the phone rings. Kathy finds out that her workers' compensation has been delayed. This adds additional stress to Kathy as her family depends on her income, and this delay will make it very difficult for them to pay their bills. Kathy begins to cry thinking about the stress this injury has caused her and her family. She tells her husband she doesn't understand how she was injured moving Mr. Smith because he only weighed 90 pounds soaking wet. Her husband points out that years of moving patients made her vulnerable to injury, and Mr. Smith was just the event that put her over the edge to injury. Kathy's husband embraces her as she says that she wishes that she made a different decision and used the appropriate equipment and knowledge provided to her to move Mr. Smith. Kathy, lost in thought, hears Chris calling her name. He is still holding the slide sheets. She tells him that even though to them Mr. Smith seems light, the use of the sheets is not based upon the weight of the patient. It is based upon the mobilization assessment which guides them to use the sheets with Mr. Smith. She takes the sheets and heads over to Mr. Smith's bed to transfer him using the proper equipment and technique. Nurses and caregivers in both hospitals and residential facilities offer one of the highest levels of work-related back injuries compared to any other profession. Back injuries occur as a result of the poor ergonomic systems that would otherwise allow caregivers to safely handle patients without the risk of harm. Back injuries account for over 70% of all injuries in the nursing profession. Just over half of all direct patient caregivers sustain an injury at some point in their career that requires time off work. Using the appropriate patient handling equipment can help you avoid injury. Not only will it help you stay healthy, it will help keep your patients, residents, and co-workers safe. We at the Mohawk Valley Health System are committed to providing a safe and healthy environment for our employees, patients, and residents. We do so by providing knowledge of proper patient mobilization techniques and the patient handling equipment to support it. We appreciate your dedication, support, and commitment to doing the same and reminding us all to handle with care.